Hendrickson, COO with the Patient-Centered Primary Care Collaborative. And welcome to our special webinar version of our monthly briefing. And in addition to this serving the purpose of our monthly briefing, in which you'll get information about the organization as a whole, we really wanted to use this as an opportunity to talk to you about a lot of the work that we've been doing over the last several months in really trying to streamline our work and position this organization to move into the next few years to really promote and make sure that we have full implementation of patient-centered medical homes, which of course you know is our primary mission, and really trying to work with all of our partners to advance primary care and all that goes along with that. So just to kind of give you a few little logistics, you know, this is different than our regular phone call-in. You all registered to participate, and we appreciate that so much. We're glad for you that have been able to participate on this live call, but we will certainly, by tomorrow at the latest, have this archived up on our website. So if one of your colleagues wasn't able to participate today, or you have to drop off early for some reason, you can go to our website and replay back this webinar in its entirety. The other little bit of a difference here on the webinar version as opposed to our just call-in version of our briefings and some of our other calls is that we won't take audio calls, so we won't put you in the queue to actually ask your question, but what you'll be able to do is in the question box that you'll see on your little panel on the webinar, you can just at any point during the conversation ask any questions. If you want us to provide some additional clarification about any of the information, you have some other clarity you'd like us to give around any particular issue, or if you have a broader issue that maybe we didn't address, you can type those in at any time, and then when we're done with the overall presentation that'll last around 30 minutes, we'll start asking those questions, and you can continue to populate those at any point during the webinar. If you need additional information or you'd like to schedule some time individually with any of us here at the PCPCC, you can also send any one of us an email. We'll have our contact information up here as well. You know, after Labor Day, we get a lot of things up and running and rolling here at the PCPCC. In addition to this webinar today, it's a really busy day. We've got another webinar that we still have open registration availability. There's slots still open if you want to participate in today's webinar this afternoon. So at 2 o'clock Eastern Time, we're going to have a free webinar on advancing primary care through health information technology. And this is really in commemoration of the 7th Annual National Health IT Week. And we've got a lot of great speakers who are going to be on the call today, including Dr. Richard Barron from the Innovation Center. So again, same with this webinar. If you're not able to attend at 2 o'clock, if you want to go up tomorrow and download that webinar anytime thereafter, it'll be archived up on our site, and you'll be able to participate in that as well. So I think the only other thing that I did want to talk a little bit about was that, just to remind everyone, we'll give you another little prompt at the end of the call, but this is the last week for early registration for our conference. We do 2 live conferences a year. This year we're really excited because we're going to be in Chicago for the very first time, and this is going to be a conference that's really tailored to all of those of you who are working on practice transformation. So and that is in the broadest sense too. So if you're a large healthcare system and you're working with primary care to help them transform into a patient-centered medical home, if you're an employer or a large state system who's trying to really promote access to patient-centered medical homes, this is going to be the conference for you. So there's going to be a lot of information that we're going to be providing you, a lot of those nuts and bolts, tools and resources that you need to actually make that transformation to patient-centered medical home happen. So again, for those of you who want to save some money, you have until the end of this week for early registration. So I'd encourage you to go on our website. Right on the front page is our banner that will get you to that registration page. So without further ado, I think I'm going to go ahead and launch off today's webinar, which again is focused on the patient-centered primary care, our new organization, our new vision, strategic plan, and organizational structure. And I'm going to turn it right over to Marcy Nielsen, our Executive Director, to get it kicked off.
Great. Thank you, Amy. My name is Marcy Nielsen. I'm the Executive Director here at the Patient-Centered Primary Care Collaborative. And what we thought we'd do this morning is just walk you through some of the work that we've been doing over the course of the last 6 months, starting with slide number 2, which is to remind you all that the mission of the PCPCC is to advance an effective and efficient health system built on a strong foundation of primary care and a patient-centered medical home. As many of you are already well aware, we are an organization that consists of 1,000 members of very diverse stakeholders. That's from healthcare professionals to employers to consumer groups to a whole host of folks in government, in business, in industry who are advancing the patient-centered medical home and primary care. And we have been busy since 2008 advancing the PCPCC, but the last 6 months we've been particularly busy as we think about the fact that we have made great success in making the patient-centered medical home a high priority among policymakers and among primary care providers. But we feel like it's time to roll up our sleeves, reinvigorate what we're doing, and do some further outreach to pull consumers, the public, more employers, etc., into our movement. And with that, maybe a little bit of history on the milestones in the patient-centered medical home development, and I'm going to let Amy talk a little bit more about some of the history of this particular movement.
So thanks, Marcy. This really has been quite the evolution, and it really has happened pretty quickly considering where we started. So if you think about where medical home originated was in pediatrics in the 60s, you know, it's kind of like that saying, you've come a long way, baby, because we have in the last few years done so much to evolve that concept, again, that originated in primary care, but now it's really taken on so much deeper, greater meaning, and certainly we've invested much more in expanding those partnerships, and certainly, as Marcy alluded to, we still have some work to do in that area. But really now, if you think about all the ways that we've started to build upon this original definition of patient-centered medical home when we talked about this central place of medical information for our child, we really are focusing so much more now on what primary care means as we advance this idea into overall transformation of the healthcare system. So we're looking at a medical home who has great use of technology that can really share information across multiple providers of care into the community and across community resources, and certainly and most importantly with the patients themselves. We're really trying to focus on efforts to ensure that patients are absolutely activated and core critical partners at the center of the patient-centered medical home. And everything that we do is really aligning around that. But we certainly have to continue to work closely with all those partners who are continuing to lay that basic landscape and create the essential elements and build those into patient-centered medical home that will make that a reality. So certainly all of our partners in primary care, all of our partners in the federal government. And in 2006, when the PCPCC was founded, it was the bringing together of those organizations, those clinicians, alongside employers who are really viewing this as an absolutely critical way to start to address not only the health of their employees, but also start to control and get their arms around the costs related to the health care that they're providing, so that they weren't paying only for quantity in services, but actually starting to align benefits for their employees to start to really look at how they can pay for quality. So again, constant movement forward on this concept as more players started to come into play. We have recognition programs for patient-centered medical home. We have all of these programs that have been launched, building on the pilots that we started in the late 1990s, but really CMS and the Innovation Center has taken that to a whole new level. This huge investment of resources and funding that's now going in to make sure that all those quality outcomes that we're starting to see, we can see en masse as part of large community-wide efforts. We have, of course, the Affordable Care Act that helped us realize that vision and got us the funding that we needed to make sure that CMS had the ability to launch these programs. And now we've certainly got this great investment by private health plans as well, and large employers that are self-insured and really trying to drive some more of those resources into primary care, and again, not just having this piecemealed network of different services, different providers, and the patient being kind of lost in all that. So we certainly have all those people together here at the table at PCPCC, and now we're just really trying to build this much more structured framework so we can streamline those messages, make everything organized in a way that everyone knows exactly what their piece is in this, and that we can communicate all of this important information on how to do this, why we should do this, and of course the evidence and the outcomes that show us that everything that we've talked about really is going to make a difference as we build towards this new overall system of health that's really built on a strong foundation of primary care and patient-centered medical home. So I'm going to turn it back over to Marcy, who's going to lead you through how we're making some of those changes here at PCPCC.
So in terms of the future role of the collaborative, it's important to remember that we've had a very successful past. As Amy pointed out, in 2006, the primary care physician organizations joined together with employers, deciding that making primary care a priority as fundamental to health systems change in this country was really going to be our mission. We've done that in a number of ways that we will continue to underscore as we move into the future. First and foremost, and for those of you who know our president, Paul Grundy, you know that challenging the status quo and the way in which we are currently funding a very piecemeal, fragmented healthcare system is something that we strongly believe challenging what we're doing now so that we can have an improved health system moving forward. How do we do that? Well, we disseminate timely information. Many of you are aware of the weekly national phone calls that we have, the monthly briefings where we explain what the patient-centered medical home is, a series of webinars throughout the year, educational conferences, as Amy pointed out at the beginning of this call, that provide us with an opportunity for networking, really convening together, learning about best practices. And then thinking about how we develop and promote innovations in patient-centered primary care. All those aspects of what the PCPCC has been will continue as we move into the future. But when you think about what healthcare transformation requires as you move into the next slide, you often hear our president talk about the 3 pillars. In order to transform the United States healthcare system, we need to think about how we deliver health services differently. So you see the top box there being delivery reform. But in order to do that, we have to be paying for healthcare services differently, moving away from our current fee-for-service structure into one that supports delivery reform and care coordination across the spectrum, one that supports payment for innovative ways to reach out to patients and their families, and moves us away from just volume toward value. So you see payment reform as a part of the 3 pillars. Next, you see benefit redesign highlighted, the way in which health insurers offer health benefits to beneficiaries and employees, the way in which we ask employees and consumers to pay for their coverage, making certain that they have skin in the game, particularly for health insurance benefits and health services that haven't demonstrated whether or not they have high value, but making certain that those things that we want patients to do, participate in preventive care and screening, making sure that we cover those benefits with first dollar coverage so that people have an incentive to actually participate in wellness and prevention. A piece, though, that's often missing as we talk about transformation is how we engage with the entire public. Does the public actually understand what a patient-centered medical home is? Do they understand what the value of primary care is? And understanding that as much work as we have very successfully done up to now, we've got more work to do when you think about public engagement and how we bring more employers to the table along with others at the state and federal level who have partnered with industry to do a terrific job advancing this concept. We've got to get employees and employers and the public to be engaging in this process as well. So what does that mean for the PCPCC moving forward very specifically? I got to this organization in January. Amy's getting all choked up about it. Bless her heart. I got here in January and took a look at all of the many activities that the organization was engaged in, and so many wonderful volunteers offering their time and their energy and their resources to advance this concept of a patient-centered medical home. But it was fairly difficult to navigate the world of the PCPCC because we had so much activity. And so we made some decisions within our organization, working very closely with our board of directors, to think about how we could clarify who does what within our organization, meaning clarify the roles that the volunteers play, that centers would play, that staff would play, that the executive committee or our dues-paying members would play, as well as our board of directors. And to make that a very rational process and one that you as members of the PCPCC and as members of the public could easily navigate. That's number one, and we'll be going into some detail about that today. Number two, if we've got our centers reorganized around what our priorities are, how do we engage our executive committee, our dues-paying members, so that the leaders in the industry and leaders in government and leaders in the health plan world and leaders in the health profession can help us think about what the future looks like and how our organization needs to evolve so that so primary care continues to remain foundational to health systems transformation. Then how do we develop a business plan for this organization to sustain that work? And we have some terrific consultants who are working with us here as staff at the board level and who just met with our executive committee last week to help us understand if this is our vision, how will we put together a business plan that supports that, and what does our coordinated communication strategy need to be in order to drive that business plan. And so you'll see we are rolling up our sleeves and getting that work done as we speak. And step number one is the new center structure, which we'll be talking about more today. We have briefly included and would just mention the timeline for all of this work. As many of you are aware, from April to June and now into September, we are implementing this reorganization. I encourage all of you either now as part of the webinar or after you get off the phone to go to our website, and you'll see the new center structure with some new resources that we recognize. Our website is still in a construction phase, and we very much look forward to your participation to tell us what's missing, what else needs to be on our website, what partners and their work do we need to recognize. We did engage in this visioning process by putting out a request for proposal. As I mentioned, the board and the executive committee met last week to kick off that visioning process at the EC level. The board's been working on this since January. The business development, once we decide what that vision looks like, we'll start the business development. We've already kicked off some of that work, some business straw man proposals. And then we'll come back and we're going to vet that business plan with our stakeholders. So members of the executive committee, members of the public will then finalize that business plan and begin its implementation at the beginning of the year. I'm going to kick it over to Amy, who can talk a little bit more about the org chart before we launch into some of the details of each center.
So I think what's important to recognize or to understand about this organizational chart is that we're really trying to ensure that there is good collaboration and communication across the entire organization. So no matter where you're individually playing a part, where you're participating, you can be assured that there's going to be a good cross-collaboration and communication amongst everything. So if you're a part of the event planning committee from the executive committee membership, then you can be assured that we're really going to be working with the event planning committee to translate a lot of this information and work that's being done at the center level and highlighting some of those particular issues that they brought to the table. If you're part of the general membership, what we're going to be doing is to make sure that you understand and are part of that communication as these different centers and the leadership at the centers are promoting and explaining to all of you what some of the priorities are going to be and how they want to activate all of you in trying to achieve those strategies and those results. And of course, we're still going to be doing a lot of the things that you've all been participating in. We're still going to have what we're called task force, special interest groups. We're still going to be disseminating a lot of these best practices through our very popular webinars and most certainly through our publications. So if there's any way or things that are going on that you feel like we could be doing a better job of communicating that information, whether it's through our website or publications or so on or so forth, please let us know, because we're going to be tweaking this as it rolls out, and there's still going to be some bumps along the road. But we want to make sure that everything is really truly being driven by that overall vision that the board sets, and that it's executed in a way that makes sense for all of our partners, whether you're part of the executive committee, part of our general membership, one of our thought leaders who's invited to the table, or one of our other partners who's really trying to make sure that this is happening as part of your organization as well. So now I think we're going to just talk a little bit more about the centers. You're going to see a lot of things that sound very familiar to you because we've already had these centers and this kind of structure rolled out in the past. But again, in our efforts to make sure that we don't have any unnecessary duplication, we have good synergy across the entire organization and all of our volunteer efforts. We've added a few things to some of the centers, we've merged a few centers, and we've created a few new. So Marcy's just going to kind of walk you through and give you a description of what some of the priorities within each of these centers are.
So the first thing to point out, our first center, formerly known as the Center for Employer Engagement, we've added purchasers to this particular center. We know that there's great synergy between what employers and health plans are doing, and we think having them together within a specific center makes a lot of sense. The goal for this center, of course, is to increase the implementation of the patient-centered medical home built on that strong foundation of primary care among employers, purchasers, and payers. And some of the activities that we expect to take place within this center, and we look to the center leadership and the center members to continue to tweak these objectives. We want to help employers and health plans and labor unions and their employees/members in accessing patient-centered medical homes in the marketplace. We want to assist human resource leaders and consultants and brokers in various organizations about the value of primary care and the value of the patient-centered medical home. And we're looking to engage both large and small employers, including corporate leaders, on the benefits of primary care and the PCMH. As Amy points out, none of this should be entirely new. This is all consistent with the work that we've done in the past, but we want to make sure that we are not duplicating efforts, and yet we are building into this structure some interdisciplinary work via our task forces to ensure that we are all working across centers in a collaborative fashion. We, of course, if you move to the next slide on the trajectory to value-based purchasing, we recognize that how we engage employers and health plans and labor unions is all part of a larger focus on how we pay for health care in this value-based purchasing sense of the world. If we need an infrastructure around health information technology to connect primary care providers and ensure that there's capacity, we, of course, want to make sure that we're building in care coordination There are lots of ways to do that, but many plans have demonstrated success by embedding nurse coordinators and plan care coordinators within their own organization. But we've got to be measuring outcomes and looking at the value, looking at quality, patient satisfaction, utilization of healthcare services, and then tying the value of the high quality of care that we're providing in those organizations to their actual performance, and offering benefits consistent with that. So these are the sorts of activities that you should expect to see within the Employer and Purchaser Center.
And I think, Marcy, not to get too carried away with questions at this point, but I think a question we just got would be a great way to kind of give an example of how some individuals might get engaged in the center. We got a question about specifically how can Medicaid directors get involved with this center, because obviously big purchaser of healthcare, and certainly you've got a lot of expertise in this area. So where might they be able to contribute and also get some additional information by participating in the center?
We would love to have Medicaid participating in this center, and as many of you are well aware, Medicaid in many states is really the market leader in patient-centered medical homes, and have demonstrated to us within the structures that they are required to work in from the federal government how you can do some of this work. Obviously, supporting HIT infrastructure, primary care capacity. We've seen a number of states do terrific work in their Medicaid programs around patient-centered medical homes, North Carolina, Vermont, Colorado, etc. Where I think Medicaid really needs to be at the table is when you think about the state insurance exchanges and the fact that now Medicaid is going to be required to partner with state insurance exchanges to have a no wrong door policy, so that anyone who is coming to get health insurance, we determine their eligibility for Medicaid, or we determine their eligibility to participate in the state insurance exchange. The synergy that you can see as Medicaid starts to work with people in the private sector really gets back to value-based purchasing. And particularly in Medicaid managed care organizations, do they have the flexibility to take advantage for some of what we see, tying reimbursement to performance? Can we do that with and for providers? We know in the Medicaid program there's not a lot of flexibility around what you might be able to charge beneficiaries, but there are still so many things that Medicaid can do and is doing, as well as being a real market leader around reporting quality, utilization, and in my home state of Kansas, I'm particularly proud of the work that Kansas Medicaid started with a focus on outcomes measurement. The work of Andy Allison, who now runs the Medicaid program in Arkansas. I can't help but give a shout out to my friend Andy. So where Medicaid can actually play into a number of centers based on sort of your role within a Medicaid office. And so we would invite Medicaid to participate in this particular center as a purchaser of healthcare services on behalf of Medicaid population, and certainly in partnership with the Medicaid managed care partners that many states are evolving to. With that, we're going to talk about the Care Delivery and Integration Center, and I'm going to let Amy tell you a little bit more about that center's work.
Sure. And I think to Marcy's point, too, you're going to see as we talk about these various centers, there's a lot of different places within your organization that you might want to get different people in different departments involved in all of our centers, or you might want to focus, just really hone in because of the attention that's being paid to patient-centered medical home is really a priority for you as it relates to purchasing or as it relates to care delivery. But we certainly want to provide all of you the flexibility to participate and get activated with PCPCC in all of these areas that you want. Certainly care delivery, this is probably our biggest capture of a lot of the work that's going on at PCPCC. This is a center where we've rolled into a lot of the work that we've been doing in the past. So under care delivery and integration, we're really talking about the individual transformation in the clinical setting, what does that look like for primary care, all the way up to how do we really build the medical home as the foundation into ACOs, the overall medical neighborhood. How are we coordinating care across specialties, across community agencies, and even in the individual understanding the context of the family with all the things that go on as it relates to their health as they're living in the community. So pulling in public health, pulling in schools, pulling in the employee setting. So this really is the biggest kind of lumping of, if you're a clinician, if you're part of that care delivery system in any way, there's going to be information that's going to be part of this center and some activities around that. We're certainly also talking a lot in this center about the role of e-health, HIT. So everything that they're going to be talking about on the webinar this afternoon is going to play into care delivery. Now again, we're going to be really cautious and make sure that we don't have too much overlap, but all of this really touches on each aspect of the care delivery system, but there will be more priorities maybe related to advocacy and policy development in that center as opposed to the care delivery. We're really talking about how do you make it happen when the rubber hits the road. These are the tools, these are the resources, this is the information that we're going to be focusing on in this center. And again, this is just highlighting the whole aspect that the medical home doesn't live in a vacuum. It's part of this larger system. So when we talk about, in the past we'd had a task force on care coordination and we focused a lot of energy and effort on that. How do you really make this coordinated system happen? That's going to be another area of focus here. All the various roles of everyone that plays a part of that larger health network, that system, and how they connect back to the medical home, and how the medical home is really the anchor to all of that is what we're going to be talking about in this particular center. All right, I think we're going to move on to the consumer center.
So the next center, and I'm just looking at the history here of what it had previously been called. As Amy mentioned, the Care Delivery and Integration Center was 3 different centers merged together. The Patients, Families, and Consumer Center was previously just called the Center for Consumer Engagement. We wanted to add patients and families into the title because we think it's very important to recognize that patients are the center of a patient-centered medical home, and their families and support from their families is critical to patients being able to access the services that they need and get the support that they need to engage in healthy behaviors based on their cultural preferences and based on their own goals. So if the goal of this particular center is to increase engagement and support for primary care in the patient-centered medical home, how is it that we will do that? We've got 4 strategic objectives that are still in draft form, and for those of you on the call who are interested in participating in this center, we think that the work that is going to be done within this center is critically important. If you think back to the earlier slide that I mentioned about the 3 pillars of transformation and the public engagement piece really having been in some ways left out of the equation, first we need to have some agreement around what patient engagement is, and that patient engagement needs to have front and center the perspective of the patient and the patient's family included. We intend to develop additional resources and strategies. As many of you know, we've long been doing that at the PCPCC, but we want to develop more resources and strategies for patients regarding the role of primary care and how the patient-centered medical home can assist in health systems transformation. So it's not just the care that is delivered to you, but how can health systems transformation built around primary care really change the way in which healthcare services are delivered in this country and promote the triple aim of improved health and better healthcare quality as well as overall healthcare cost reduction. How might we develop strategies that include patients in evaluating patient-centered medical homes and in quality improvement? These are important aspects of patient engagement that all too often get left out of the equation. We think if we're including patients in a dialogue about their health, that we've done enough. But patients need to be included in improving the overall health system as well. And then how can we work together to develop resources and strategies to address health disparities, health literacy, cultural competency, all as part of the patient-centered medical home. When you think about the importance of communication, not just to patients, but with patients, we need to think about ways that the patient-centered medical home and primary care can reduce health disparities and improve health literacy and cultural competency. You will see listed next in your slide 15, an acknowledgement that individuals and their individual behavior is sort of where patient engagement begins, but it broadens into social and family community networks. How do we think about the social ecological model, all of the ways in which society has an impact on our health, our living and working conditions, and the broad social, economic, and cultural aspects of where we live and how they impact our health. Remembering that a patient, at the end of the day, is indeed a consumer, and that they want the best value for the dollars that they spend in this system, but that they are looking to elect policymakers who recognize that there's a better way for us to be promoting health in our population, and what and how can primary care do and be in that process. I am now going to turn it over to Amy to talk about the Advocacy and Public Policy Center.
Well, I think exactly what Marcy just started talking about rolls right into what's going to be addressed as part of Advocacy and Public Policy Law. So, you know, this is kind of an area where we're going to be really looking at a couple different aspects of advocacy and policy. Certainly, all those things you think traditionally happen in D.C. I mean, you know, we're certainly very engaged in the conversations that are going here, helping develop that public policy advocacy agenda here at the national level, talking with all of our partners in the federal agencies to ensure that they have policies and programs that reflect a lot of what we're talking about as it relates to ensuring that we have the right resources, we have the right regulations, and we have all those things in place that are going to really support and drive further implementation of patient-centered medical home. And then certainly also, again, within the context of accountable care organizations. So not just what would be in the care delivery center around ACOs is how do you actually make an ACO work? How do you make sure that the medical home is truly functioning within the ACO as that foundation, as that backbone, that structure that's really kind of guiding a lot of the care in partnership with the patients. But here in the policy world is talking about a lot of that model language within, you know, communities and contracts and within the, again, federal agencies. And back to Medicaid, too, is when you're thinking about how you're going to be playing a partner in that, how can we guide some of those overarching principles that need to be incorporated into those models. And then, of course, promoting medical home is all those things that we talked again about, the exchanges, Medicaid, Medicare, and all of the state and regional efforts that are happening. And then, again, you know, back to the role of the individual, the consumer and the public, too, is to helping make sure that we have a voice for the public at large as part of this overall process in transforming our healthcare system, helping make sure that they understand and they're able to communicate as they're being brought to the table to help design some of these systems, that they really understand and appreciate why it's so important to have that medical home as that foundation. So I don't know if you want to elaborate on that at all, Marcy.
I think the only thing that I would add is that we recognize that while so much of the action around public policy was happening in Washington, D.C., as federal health reform was being debated and ultimately signed into law, now much of that emphasis as we think about Medicaid and state insurance exchanges is devolving to states. And of course, as I mentioned earlier, state action around patient-centered medical homes, there's a rich history there. National Academy for State Health Policy does a terrific job of describing what's happening at the state level and in particular states, and we want to continue if you move to the next slide, to think about how we support the work of states. We partner with NASHP and a whole host of other organizations, NCSL, the National Council for State Legislatures, the National Governors Association, etc., who are our partners at the state level who are doing terrific work in this space. And who are the many partners at the federal level who are advocating on behalf of primary care and the patient-centered medical home. As Amy pointed out, we want to do direct outreach to the public to explain the value of patient-centered medical homes and primary care, because patients are consumers, are voters, but we also want to work directly with the legislative, judicial, and executive branches to make sure that they are advocating the best public policy. Next, I might just move on to the, if I can pull mine up here, the Outcomes and Evaluations Center. So we've had, as we just mentioned, and of course, as many of you are well aware, we have a long, rich history of doing advocacy on behalf of primary care and the PCMH. We also have a long history of doing outcomes and evaluation assessment, what's working within the patient-centered medical home. We've got a couple of important documents that we shared in 2009 and 2010 that highlighted the outcomes from PCMH. But we've not had a center where this work would really be done in partnership with a lot of leaders in the field. You think about the work that the Commonwealth Fund, for example, is doing within their PCMH Evaluators Project. So this is a brand new center. The goal here is to demonstrate the value of primary care in the PCMH using appropriate data analysis and evaluation methods. There are so many of you who are doing work in this particular space who we hope to be partnering with as part of this center. Our goal is to develop resources and strategies to obtain, aggregate, track, trend, and analyze information from a whole host of sources on medical homes, looking at cost, quality, and population health outcomes. We then want to disseminate that information, that outcome data. We want to share that across centers. We want to share that with our general members and to the public, and think strategically about how we share that information through a host of various resources. And then we want to advance the refinement of those outcome measures. We want to continue to improve on the patient-centered medical home, recognizing that we're on a journey, as David Nace, our chair, told us last week at the congressional briefing that we had to roll out our new outcomes report. This is a journey, and recognizing that we can and will use the data that we gather from different sources to improve the care that we're providing through a patient-centered medical home. And I would just point you to slide 19 and tell you we're very, very pleased that the Milbank Memorial Fund graciously and generously provided funding for us to update our reports from 2009 and 2010. This is a very robust report. It highlights 34 recent peer-reviewed and industry reports on the patient-centered medical home, broken out by states. We look at healthcare costs, acute care services, quality of care. We provide those metrics for you in a very easy to read, I think, sort of digestible format. And then we provide some additional details on 23 case studies that drill down into the particular features of a patient-centered medical home and how the literature is demonstrating that the patient-centered medical home built around 5 specific areas using the AHRQ's definition. Really, we've got such a phenomenal set of literature to draw upon and learn from, and I think this report just come out last week will be a terrific resource for you to use in your organizations with policymakers that you interact with, and hope that you find it useful. I'm going to turn it back over to Amy to tell you a little bit about task forces and special interest groups.
Yeah, so this is the problem when you get two talkers on the phone. We end up talking more than we should and not allowing enough time for questions. So I'm going to run through these last few slides really quickly. And reminder, just if you have any questions, go ahead and type them in. Again, I'm trying to make sure we're addressing some of these as part of the overall conversation, but I do want to make sure we have some time allotted at the end for additional questions. So just to kind of let you know, again, I had mentioned we've always had task forces. Some of them have been really more what we're now calling special interest groups. So really for task force now, just some kind of, as Martha would say, inside baseball information. I mean, it's really meant to be to perform a specific task. So something that the board says, based on all the feedback and information that we've gotten from our various centers and all the leadership there, we really feel that we need to do a new publication, we need to have a new resource available, something more specific that has a beginning and an end point. And we're going to really be sure on all of these task forces that we have input from multi-disciplines, from lots of different disciplines. Certainly we want patients and consumers to be participating in these. So these are kind of an evolution of some of the activities that we've already started here at the PCPCC, and as we're evolving, moving into some more finer articulation of what those would be and what those resources and activities ultimately end up being. Again, the special interest groups, this is an evolution of what we've already had. Right now we're continuing to work with behavioral health, medication management, and e-health because for as much as we're concerned and we want to make sure that we have individuals who have these particular issues at the forefront and have a lot of expertise in those, we want them to inform all of our centers. So if you're participating right now in a special interest group, we also want to hear your voice within part of our center work. So we want to see you and hear from you there. But we also want to provide that venue and opportunity for you to all meet with your colleagues and like-minded individuals who really have a passion around these particular issues to, again, continue to talk with one another, share that information, those best practices that are happening, and then to, again, communicate that all back up through the centers so that when there is an expert speaker that we want to have identified and highlight their work, that we can get that into our webinars, certainly within our publications and all of our events and resources on the website as well. So again, we're going to continue to do all those things that you look to us to do, all of our publications. We mentioned at the top of the hour that we're really working to make sure our website has evolved and really has all that comprehensive information. In fact, Lauren's going to queue up some questions for you after you sign off on this webinar to ask for some additional input from all of you on some resources that we can make sure that we're linking to and have accessible on our website. Because again, we really pride ourselves in our ability to kind of coalesce all this information, these best practices and resources that all of you and your individual organizations are developing to help bring primary care to the place that we're hoping that it's starting to come to. So we want to continue to be the good disseminators of that information. And again, still doing that in person at conferences and meetings. And we love to meet all of you all. We love to have those opportunities to do that networking. I mean, there's still something that you can't replace on a webinar of having that face-to-face interaction and those dialogues and conversations. So we really do value the time. We know it's expensive and that you all are more mindful of what resources that you have that are limited to attend these kinds of events. But they really are important, and we hope that you are able to continue to participate in them and that you invite your colleagues. Again, by kind of moving outside of Washington, D.C., we're hoping to get more people from the Midwest who haven't in the past been able to participate in our conferences. But again, we really want to take advantage of all those opportunities to meet with you. And I hope that you come up to us at the many different opportunities for networking and introduce yourselves and let us know, very frankly, what's working, what's not working for you. We certainly want to hear all of your voices. So as we roll out these centers, there's going to be a lot of opportunities for you to get involved. So here's the listing again, and these are up on our website as well, how to get involved in each one of these various centers. Now these are going to be just call in, so you don't have to register in advance. But this is going to be, the first call this September is going to be kind of more information that we talked about today, a little more detailed, an opportunity for you to have a voice in how these centers start to take shape and some of the priorities, because as Marcy mentioned, we have these strategic objectives, but we're still able to kind of flex and modify those as we see we need to in order to accomplish our overall mission. So we hope that you're able to participate in at least one, if not more, of these centers. Please do invite all of your colleagues. These calls are open to everyone. We really want to provide this as an opportunity for you to figure out where best that you can plug in your expertise and your resources and really get engaged with everything that's going on at the PCPCC. So I'm going to turn it back over to Marcy if there's any closing remarks she wants to make, and I'm going to run through to see if we've got some additional questions that you all want to ask. And certainly, again, don't feel shy to go ahead and email or call either one of us. We would love to hear from you if you've got a specific question about how you really want to get more engaged within your organization. Feel free to send those questions directly to either one of us, and we'd be more than happy to answer those for you in that format as well.
So my only closing comments are to thank you for tuning in and listening to a description of this new center structure. To thank you in advance for engaging in the center or centers of your choosing. Hopefully this has been useful. We do have an accompanying memo that describes specifically the role of some of these centers that we are happy to share around, and can certainly email to anyone who got registered for this particular webinar. And it sounds like we have a couple questions that are relevant.
Yeah, I think this would be a good one for you to respond to, Marcy. A specific question around which of the centers, or maybe multiple centers, will be an opportunity to learn more about systems thinking. So how do we address the needs of leadership, and maybe even giving some additional leadership skills to individuals around the overall system of care?
Yeah, I think that work is logically placed within the Care Delivery and Integration Center, thinking about how we put primary care as foundational within the medical neighborhood. We really have to do systems thinking. Of course, it's one of the definitions of having a patient-centered medical home. We, as Amy pointed out, we're not limited to only discussing that there. I think leadership, as you look through the literature and what really works when you're trying to transform a practice, leadership being at the top of that list. If there are folks who think, we'd really like a webinar specific to the topic of leadership, I think that would be a fantastic topic to dig into. But I suspect that the systems thinking piece will probably be most appropriately placed within the Care Delivery and Integration Center.
Yeah, and we do actually have a couple of archived webinars right now on our website that have specifically addressed the need for that leadership and how you can help your individual organization or even practice clinicians and patient advocates acquire some of those leadership skills. And if you have additional resources, too, that you'd like to contribute, that's a great area that we'd like to continue to build on, even within our list of resources within the care delivery system. There's a question specific to NCSL, National Conference of State Legislators, on adopting language for a medical home. I don't know if you know specifically if they've, as an organization, adopted specific language around that, but I think that's certainly an area that we're looking to around the policy to have some of that model language crafted around how do you integrate patient-centered medical home. And certainly we've already developed some publications. We have one specific to the state exchange about why that's important and incorporating that language moving forward, and kind of targeted as some marketing materials for state legislators. But I don't know if you want to kind of talk more specifically to that.
I am a huge fan of the work that NCSL does, and Joy Wilson in particular, and we've talked about her engagement on the Outcomes and Evaluation Center, or perhaps on the Advocacy and Public Policy Center. I do not know that NCSL has specific model language, although it's certainly possible. States often like to craft their own. Some states actually use their own accreditation process within their own Medicaid program. But I suspect that that is an answer that we can certainly hunt down. And again, as you pointed out earlier, Amy, our goal is really to be the collaborative to bring together resources so that people can quickly put their fingers on who's doing what, NCSL being one of many terrific resources for state policymakers, and we can reach out to Joy and get the answer to that question. I'm not familiar with it if they've got some.
Yeah. Well, and I swear I didn't type this question in myself, but you'd think I had it planned to queue up. I think we got time, and this is a great ending question, specifically around workforce development and education and training. So what is the PCPCC going to be doing, and how are we going to address the needs of workforce development when we talk about interprofessional training, team-based care training, bringing in all of those disciplines that are part of that care team and part of the larger workforce too? How are we going to be addressing that as part of this structure?
So we have an education and training task force now that is, I think, very interested in getting re-engaged with this new rollout of centers. They started to do some work, and now we're looking to partner with AAMC. There are a number of folks from multiple different professions who are engaged in this work, focused just on the areas that you mentioned. How is it that we're training health professionals in team-based care? What competencies do you need to have to be able to do this kind of work? I will tell you, it's an area that I worry a little bit about. We are doing, I think, a terrific job of advocating on behalf of the PCMH, but we need to be training our health professionals of the future to actually operate in that model. And one of the challenges we have is that the folks who are training these particular health professionals and clinicians, they themselves have never operated in a patient-centered medical home. I was just at the University of Michigan just 2 weeks ago, and they're doing some innovative things there. One of the most important things, of course, that you can do to be training your students is to have them working in that environment, providing them with clerkships, etc. But the AAMC put out a terrific publication in 2010 on 7 different sites around the country that are doing innovative things to advance primary care in the PCMH. And one of the things I suspect that our task force will do is go out and do some additional field work and highlight more examples, because I think educators recognize that they need to be doing this training differently, but they need to have some models and best practices upon which they can transform their own educational programs.
Great. Well, we're at the top of the hour now. For those of you who did ask questions and we didn't give you a specific answer, I know some of you put in some questions that you want some individual follow-up, or you have some more specific concerns. We will be following up with every one of you. We want to thank you all for participating in this webinar. We hope that it was very informational for all of you and helping figure out how to kind of work your way back into the PCPCC if you haven't been participating of late. And really, we hope that we get some great input from all of you and how we can continue to improve the ability of every single one of you to get actively engaged, share those resources and information, and really help to advise us on some next steps and ways that we can help address many of the challenges and barriers that we know are still out there. But we really, really are concerned about making sure that all of our efforts are as best refined as we can to get the biggest bang for our buck, to get the biggest use of all of your time and energies to see where we can really have some focused energy and attention to drive medical home forward, not just in the upcoming months, but in the upcoming years as well. So we certainly have lots of work to do. Thanks for all of you who've been standing next to us and participating since the beginning. We really hope that you continue to stay engaged and bring all your friends on board too as we really move this and evolve this into the future. Again, this webinar will be available up on our website, so if you want individual copies of the slides, you can either play back the webinar or just download the slides if you want to share this information. We'll have all that available up on our website no later than tomorrow. So thanks, Marcy. Thanks, Lauren. Thanks, everybody who was on the call today, and we'll be hearing from you and talking with you on upcoming center calls. Bye-bye.